What I'm going to try to explain to you is how I counsel people that come to my office with aging face complaints, and also just shortly and briefly walk you through the different techniques that we use nowadays in aging face surgery and facelift procedures specifically. And we'll do that with the pictures of Diana Gabriels in front of us, and you will also see some surgical clips of the procedure that I did on her. When people come into my office with aging face complaints, the first thing that I try to do is explore with them which ingredients, which components of the face are a concern to them. Even though usually we are in sync, usually what I see is usually also what they bring as a concern into the office. But this is not always true. Sometimes somebody is concerned about other elements of the face and the elements that I would prioritize. So it is critical that you allow people to talk in the consult, in the first half of the consult, to really listen to them and appreciate what their concerns are and see if they are in sync with what you as a surgeon believe would be the best improvement of their face. In this case, Diana told me that she was particularly concerned about the lower thirds of her face. She's had an upper lid blepharoplasty done in the past, was pretty happy with the way that her forehead looks and her brow position and her lids and her mid-face. So the primary concern was really that she appreciates increasing of aging symptoms in the lower thirds of the face. Typical jowling and squareness of the mandible, and some looseness of the skin in the neck. The neck used to be a lot more acute than what you see in this picture. She's a very fit and lean woman, so there's not a lot of fat in her neck and in her face. So if you discount that, you can imagine that she had a much more acute angle when she was a younger woman. So discussing this, what I do is I walk through the several ingredients of the face, and I think she looks great for her age. Has treated herself well. She's had very little done to her face, except for blepharoplasty and maybe some Botox and perhaps some local fillers, nothing else. You do see that she has some aging of her skin, not so much that there's solar damage, but there's some fine wrinkles in the skin of her face. And also, if you touch her, you can appreciate that there's a lack of elasticity in her skin, and this is really important to explain to people. So if you sort of stretch the skin, it feels like there's a lack of elasticity, and this is something that comes with age. In terms of her upper third, her forehead looks beautiful, and her brows are in a perfect condition and perfect shape and perfect height. Her upper lids look fine. She has a little bit of excess skin in her left eye, but she wasn't concerned about that. You can see that she's a little bit bony on the right, in the right orbit, perhaps as a result of previous blepharoplasty surgery a long time ago. Especially in people with a low body mass index, you typically would see that they lose fat in the upper orbits. So, and if they've had surgery done before, that can show when you age. But she wasn't really concerned about it. In terms of her lower lids, a little bit of what we would call a tear trough deformity, but nothing that she was worried about. Her cheeks look fine, maybe a little bit lacking volume in the mid portion, but on the sides she looks beautiful and well defined. And as soon as you get to the lower lids, a little bit of a long upper lip, but there's some folding of the skin, marionette lines are visible, some deepening of the nasolabial folds. You can see that the mandible has become kind of square because of that little skin that is hanging over the edge, which we call a jowl. And if you look at her neck, you can see that the jawline is not very distinct, and there's some looseness of skin and muscle in that submental area. So those were the components that she really wanted to address. Now, if you take all of this combined, that makes her a good candidate for facelift surgery. So that's what I discussed with her. And so the next thing that I would like to do, and I also do with all my patients, is walk them through the different concepts and the different types of facelift surgery that are available to patients. It can be quite confusing because there's so much name calling in facelift surgery. And so what I typically try to do is break it down pragmatically into two broad concepts. And the first one is the length of the scar and the positioning of the scar. A lot of facelifts, probably the most facelifts that are done nowadays are what we would call short scar facelifts. And short scar facelifts typically would start somewhere here at the hairline, would run in that shadow of the ear, typically would come behind this little piece of cartilage, which we call the tragus, resurface here, follow the earlobe, and typically would stop just around the corner of the earlobe, as right there. Now, the length of the scar doesn't tell you everything. It does tell you that you can't remove huge amounts of skin through this incision, because typically there will be more here and you would need to extend that incision into the temporal region. You can reach far into the face through a small incision, but still, pragmatically, most people that use a small incision elevate the skin limitedly, so hence would elevate it up to about this level. And as I said, it doesn't need be, but usually that's what people do. So then the critical question is, what do you do with the deeper tissues? We don't lift the face based on the skin. If you lift based on the skin, you will get stretch marks, you will get a widening of your scar, you increase the risk of scar healing problems. So we've stopped doing that a long time ago. So what all of us do nowadays is we lift the deeper tissues, which is what we call the SMOS, which is sort of a fascia or muscle that runs in the face and in the neck. Usually when people use a small scar and limited elevation, they use sutures to elevate the muscle. And what they would do is they would place a suture like a purse string through the muscle, go around, come back up here where the tissue is somewhat deeper, maybe even back here, and sort of pull the whole skin soft tissue envelope up. You can extend these into the jowl region, you can extend them in the mid-face if you elevate them further, the skin further into the face. And in people that have lighter forms of aging, this can actually be a quite effective way of operating. But in general, I believe, and certainly if there are more significant signs of aging, the durability of this procedure and the magnitude of the effect is somewhat limited. And many of us nowadays like to operate a little bit more into the face to get a better and natural and more durable result. So what I do, and with me many people use the same kind of approach, is I use a higher incision because I know that I probably have more skin to remove from the mid-face. I follow the same shadows as I showed you before, turn around the earlobe, and then if I continue behind the earlobe, really has to do with the redundancy of skin in the neck. If there's significant redundancy in the neck, I will extend the incision behind the ear. So let's do that for now, extending it into the hairline. So what you need to remember is that this incision in the hairline really is meant to deal with all the excess skin that you have in this region. So if there's significant redundancy of skin and muscle in the neck, the incision behind the ear, at least in my hands, is really essential. If it's not, you may stop at the earlobe. The incisions in front of the ear are really meant to deal with the mid-face region and to deal with the jawline and with the jowling. So the next thing is elevating the skin off the deeper layers, and what I do is I do a biplanar facelift. So I do that quite extensively, move forward, come a little bit backwards here around the mouth, come back forward right here. And I do the same in the neck. I release the skin of the deeper tissues and of the muscle. And again, as I said, the critical question in facelift surgery is, so how do you handle the deeper tissues or the muscle? So what I do, I operate in a deeper layer. So I cut right through that superficial muscle like this, come down into the face and into the neck. And I elevate this very thin muscle off the deeper tissues. And it becomes sort of almost like a hammock that you can resuspend to the tough tissues up here and that you can suspend behind the ear. And that is really what gives you the lifting effect of the mid-face, of the jawline and of the neck. Now, as I said, I believe that this way of doing surgery really increases the magnitude of the effect. It increases the durability of the effect, and it typically leads to very natural results. We added what we call a composite graft, which is a small piece of cartilage and skin that we removed through an oval incision right here. into that sort of highly arched nostril of hers to lower it down. This incision heals beautifully. This is a small touch-up kind of procedure that we usually use after rhinoplasty, because this tends to occur in some of our rhinoplasty cases. But in her it's all natural. She never had surgery before, and it really lowered her nostril quite nicely and makes her face look softer and more friendly. So that's what we did.